Golden Opportunities is paid for by Elder Productions.
Hello, I'm Lori Steiner. Welcome to Golden Opportunities.
Today, we'll diagnose important medical news that's good for your health. Then, when it comes to investments, is time on your side? We'll look at how investing today could mean more money tomorrow. Some are taking a vacation from vaccinations. We'll tell you why immunization remains vitally important. Plus, our area has an agency that assists with aging. We'll reveal their many reliable resources. And the cost of higher education just keeps getting higher. We'll school you in the best ways to save.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. It's the conversation no one wants to have, but everyone needs to have. We're talking about advanced directives, the way you want to be cared for as you approach the end of life. Dr. Matt Frantz is here to help us begin this conversation. Dr. Frantz is in family medicine with Metro Health. Welcome to the show.
Thank you.
Now, you've seen firsthand what can happen when that conversation hasn't taken place.
Certainly. Far too often do we have patients in the hospital that are at the end of life and they've suffered a severe stroke or they have advanced dementia, or they have some kind of life-ending or life-near-ending event that ends them in an intensive care unit or in an area of the hospital where they're in dire straits. And a lot of these times, these patients don't have a chance of getting better, or their issues are to the point where we really need to start talking about end-of-life issues.
Yeah, and not everybody has done that, and it's hard to do that.
It's a very hard thing
when
to do.
a loved one is there laying in that situation, it's hard not to say, "Oh, keep them alive,"
Right, and we see that on a weekly basis where somebody comes into the hospital and not that we didn't know the event was going to happen, but they didn't prepare themselves for the event. A lot of the 60% of the healthcare dollars spent in the last 6 months of life, and that's resources that sometimes we utilize in instances where there really is no hope, and for people who quite honestly wouldn't have chosen to be in that situation if they had the opportunity to have said something about it. When somebody's in a coma state, they can't come back and say, "Hey, listen, I really didn't want this procedure done, or I didn't want these things done to me," and sometimes we're forced into doing things that, as physicians and as nurses, we aren't comfortable with.
And I suppose sometimes, the family is not all there together all the time. There's somebody who hasn't been a part of any conversations whatsoever who might make things more difficult.
Absolutely. Some, family members that are near and close, sometimes they can watch the eventual deterioration of a patient, and they understand, this is a natural, event. Dying is a normal, natural part of life. I mean, like it or not, we're all taking that journey at some point in time. Nobody gets out of this place alive,
Yeah.
is how they put it.
So we know that. How do we start that conversation, though?
I think it's important to have that conversation with your family members. There's plenty of opportunities where the families are together, and it sounds like a morose conversation, but it doesn't necessarily have to be. When you're in good health and you can sit down and open that conversation with your family, you can say, "Listen, I don't plan on going anywhere anytime soon, but at some point in time, these issues are going to become important, and I want you to know how I feel."
And that's when you can talk about DNR and do not resuscitate orders?
Do not resuscitate orders. Those are very important. Do not resuscitate orders are orders that we use in the hospital that there's two major ones. There's do not resuscitate comfort care, and there's do not resuscitate arrest. And there's subtle differences between the two, but those are the terms that we use to signify that, no, we're not going to come in and put this patient on a ventilator, and no, we're not going to come in and shock this patient, and no, we're not going to come in and start compressions to the point where we're causing actual damage and pain to the patient.
Okay, so it sounds like a discussion with the physician maybe from the family and then the family all together to make these final choices for end of life?
I think every patient should talk to their physician at some level and tell them what they believe in and what they want at that point in time in their lives, and then should carry that conversation back home and talk to their entire family, because it's going to be the one family member that they haven't seen in 5 or 10 years who comes out of the blue and says, no, wait a minute, let's do everything.
Yeah.
And
that doesn't help anybody.
That's not what anybody wants. It's very counterproductive.
So,
correct.
No one wants to talk about the time when we could lose our parents or when we ourselves are at the end of our lives. But not talking about it only makes things harder for those who are faced with end-of-life decisions in our places. So you got to have the conversation now so that you'll know what needs to be in place later. My thanks to Dr. Frantz for helping us begin this difficult discussion.
To learn more, call Metro Health at 216-778-7800 or log on to www.metrohealth.org. Next, there's no time like the present. But first, did you know DRAB was an acronym? It is when it comes to slinging political slang about a current candidate. So what do these 4 letters stand for when being used against another nominee? We'll spell it out for you when we return.
Hilltop Village Apartments is retirement living at its best. Residents enjoy a wide variety of activities and living services with all large first-floor apartments, private screened-in patios with beautiful park views, daily dining room meals, free laundry facilities, 24-hour staff, and so much more. Enjoy safe, comfortable independence at a very affordable price. Call today for a tour and learn how you can get your first month's rent free. Hilltop Village Apartments, retirement living at its best.
If a candidate isn't colorful, you may decide he is drab, but the real translation of the term is doesn't rock any boats. Does that mean smooth sailing for a quiet contestant? Only the voice of the voters can answer that question.
We all want to retire comfortably, but the uncomfortable truth is most of us haven't financially prepared for that. Jim Lineweaver is here to add up the ways we can make the money we worked so hard for us work for us. Jim is a certified financial professional with the Lineweaver Financial Group. So welcome, welcome.
Thanks.
We're getting close to retirement. Time is no longer on our side. So how bad really is the situation?
Yeah, it's pretty bad, unfortunately, for most Americans, that is. Because according to the National Institute of Retirement Services, they said 45% of Americans have nothing saved for retirement. And then of those between 55 to 65, they've actually, on average, only saved about $12,000. Now, of those that are savers out there and close to retirement, they've only saved on average $100,000. Now, you'd think that might be a lot, but if you have to rely on that for the next 20 to 30 years, it's not a lot of money.
No, and people are living longer, so how much should we save for our retirement?
Well, everybody's situation is different, but what ends up happening is that depending on the Social Security that you may have coming in, any other pension income and things, you add all those up and then you may have a shortfall. So that shortfall needs to be made up of your investments or retirement accumulation, and based on about every $100,000 that you've put away, use a 4% consumption rate. So that means if you had $100,000 saved, you could use about 4% or $4,000 per year, and if structured correctly, you shouldn't run out of money in retirement.
Okay, so how though, if we are facing not enough, how do we increase the nest egg?
Right. Well, what happens is you can try to obviously put away money, but it comes down to how much can you save and what type of a rate of return can you get on that money. So let's say you were looking out over a 20-year period of time and you wanted to get $100,000 set aside. For zero interest, obviously you'd have to save $5,000 a year. But if you could earn about 3% on your money, all you'd have to do is put away $3,600 a year to come up with that same $100,000 in 20 years.
Okay, but you're talking 20 years. Some of us may not have that long. So what can we do today that will help for tomorrow?
Right. Well, what ends up happening is then you're looking at actually basically the rate of return. So we gave you an example of like $600,000. If people are trying to accumulate to that, depending on your age, if you're age 55, and let's say you can get 5% return on this money, you're going to have to save $3,800 a month to get to that. If you're age 45, you'd have to save about $1,455 a month, and if you're age 35, about $720 a month to come up with that same $600,000 in 20 years.
Okay.
So obviously time is a huge factor.
And that extra little bit of interest coming to help build up that $600,000.
It does help.
It's a lot of information, but you have a way for our viewers to help understand it a little bit better.
We do, because you don't get a second chance at retirement for most people, and you don't want to have to go back to work. So you got to get it right the first time. So we have some education programs coming up. The first one's going to be on Tuesday, October 13th at 1 p.m., and another one Thursday, October 15th at 6 p.m. in our Valley View office. And your viewers are free to attend, but I'd recommend calling as soon as they can.
And make that reservation, learn more about this plan, right?
Exactly.
No matter how much time you have until your retirement, it's time for your money to get growing. To learn more, attend one of Jim's seminars or give him a call. The number's coming up next.
For more information, call the Lineweaver Financial Group at 1-888-313-4009 or click to www.lineweaver.net. Next, giving vaccinations a shot in the arm. Looking for places to go? Things to do? Welcome to our community calendar. Learn to fight online identity theft by attending a free safety training lesson presented by AARP's Fraud Watch Network, Wednesday, October 14th from 6 to 8 p.m. at the Beechwood Place Microsoft Store. Experts will help you develop the skills you need to be safe online. To learn more or to register for this free training, call 1-877-926-8300 or log on to states.aarp.org/region/Ohio.
When we were raising our kids, there was no question. They got their vaccinations on schedule all the time. Today, there is a debate as to whether immunizations are really essential. Could your grandchildren be at risk if they avoid those injections? Dr. Robert Resnick is here to quiet the controversy. Dr. Resnick is the Chief Medical Officer for Medical Mutual of Ohio. Welcome back to the show.
Thanks so much.
Well, first, tell us how vaccines actually work.
Vaccinations or immunizations are an incredibly effective preventive strategy. They work by getting the body to produce an immune response to fight those infections off before they even have a chance to take hold. Any provider will tell you that it's cheaper, it's safer, and it's better to treat the infection before it even starts. So it's a much more effective strategy. This has made diseases like polio and diphtheria of practically historical interest in the United States, just because so many people are getting immunized.
But we hear about scary side effects. So, should we really be worried about the immunizations now?
Yeah. Our parents, our grandparents told us there's no free lunch. And so for everything you do, there's always some risk. But the risks associated with these immunizations are very, very small. They might be a little bit of a skin reaction, or they might be a little bit of a fever. But compared to getting the disease, they are much, much safer.
All right, well, that's good to know. But why then are some young parents against immunizations?
I think for one thing, they take pause because there are so many more of them than there used to be. And I think that really is a big factor. But I think the largest factor, Lori, is that they haven't experienced or witnessed the ravages of these diseases the way our parents or grandparents do. Back in the 1950s, there was a terror, a panic because of polio. Kids were getting withering limbs right in front of these parents' eyes. It was horrifying for them. In addition to that, there is the internet, which is a good source of information. Unfortunately, it's a source of misinformation. And then media play on these things, and without knocking the media, it becomes a big deal and a controversy.
Okay, so how do we know who to believe?
I think a good piece of advice comes from the American Academy of Pediatrics. And what they do is that they suggest that you look at who is providing the information and look to see whether or not there are any data to support that. Is it based on sound medical research, or is it just an opinion or coming from a chat room? It's very important that we see how well this is founded. And one of the major sources is the Centers for Disease Control and Prevention. The American Academy of pediatrics that we already discussed, and the Immunization Action Coalition is a very good source. The National Network for Immunization Information is very credible in giving us good information that's based upon evidence.
Okay, so there needs to be testing, it needs to be up-to-date information as well?
It needs to be up-to-date information, and it needs to pass the common sense test for you. It needs to
The
be
smell test.
The smell test. It's very important that you think it makes good sense to you and that it's based upon some good research.
All right, this has been very valuable information. You or your parents may remember when daunting diseases like polio were prevalent. Thankfully, for years now, we've been able to prevent them thanks to the immense assistance of immunizations. If you're still concerned about vaccinations or you have any questions, follow Dr. Resnicky's advice and get the facts from a reliable source. My thanks to Dr. Resnicky for joining us today.
Oh, my pleasure.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com/2015options, or call 1-866-488-3266. Next, aging, take action. It's time to get up and go, an exercise minute on golden opportunities.
Hello everybody, I'm Mike Carbon from Breakout Fitness, and we are here today to show you how to do a kneeling Superman. This is an excellent exercise, Lori, that's not only going to work the core, but also the lower back. You ready to go?
I'm ready.
Let's do it. All right, we're going to start this exercise on all fours. Here in the studio today, we have our exercise mats. You at home, go ahead and grab a spot on the floor. We're going to start with our hands about shoulder width apart. We also want our knees the same. Looking good. Now what we're going to do here is we're going to start with our right arm straight out in front, and we're simply going to try to get our left leg straight out behind us in the back here, okay? We're going to hold that for a 3 count, keep your balance, and then we're going to go ahead and we'll switch sides.
Oh, okay.
So left arm straight out, right leg out, and we're going to hold it again for a 3 count. Okay, we're looking for 12 to 15 repetitions. How you feeling?
Oh, out of balance.
You got it, keep your balance. All right, everybody, 12 to 15 repetitions, 2 to 3 times a week, and now it's your turn to get up and go. There you go, perfect. All right.
For your copy of the exercise booklet, send $1 for postage to Golden Opportunities, 6105 Parkland Boulevard, Suite 140, Mayfield Heights, Ohio, 44124.
Last year, the Western Reserve Agency on Aging's resources reached nearly 500,000 people in our area. So what are these services that help so many seniors? Dr. E. Douglas Beach is here to tell you. Doug is the CEO of the Western Reserve Area Agency on Aging. Welcome to the show.
Thank you. It's great to be here.
So we want to hear about all these services. What are they?
Well, there are a whole plethora of them. We do planning, administration, coordination of the Older Americans Act program, as well as some state-funded programs. And it helps us do anything from information referral, we do transportation. Our biggest programs are meals programs, and then we are also a partner in the MyCare Ohio Medicaid programs.
Okay, and helping people get who are disabled and everything get the medical attention as well, too, right?
The dual eligible project with MyCare actually allows us to help coordinate not only the medical side but the social side.
Okay, and there's a program called Passport.
Yeah, well, Passport actually has been phasing out a little bit.
Has it been?
Yeah,
oh dear.
And what's in its place is MyCare.
Oh, okay.
And as you,
so MyCare Passport,
yeah,
same idea.
Yeah.
Okay.
As you may recall, Passport was budget limited, and you couldn't get unless there was get in home community-based services unless there was enough money. But with the MyCare program, people can choose between a nursing home or staying in their home if that's what they choose to do.
So this can help them stay at home, which I know most people want to do. So what's a little bit about the process?
It's a tremendous process. Well, first of all, you have to get certified both functionally and financially. Poor enough and sick enough that you qualify for the programs. And then once people get certified, then we'll go in and do an assessment, screening assessment. We'll go ahead and put in a care plan and work with our various funding partners to make sure that those services are in place as quickly as possible.
And that's great, because people really do want to stay at home. Yeah. You also mentioned meal type planning.
Yes.
So does that mean Meals on Wheels, or are there other programs?
We are the Meals on Wheels provider in the 5-county area. Make sure I get this, Cuyahoga, Geauga, Lake Lorraine, Medina.
Okay.
And that wasn't bad.
Yeah, that's important to know.
Yes, all 5 counties. We provide about 5,000 meals a day.
Wow.
And what we find with our meals programs is often that's the only contact that people will have, particularly on Meals on Wheels, with a person every day. And then we're also trying to push our congregate meals programs, which is at senior centers. But one of the things that happened recently is they came out with, I think the federal government came out with an index on nutrition risk. And Ohio was the worst state in the Midwest in nutrition risk.
Oh, that's not good.
And one of the 10 worst states in the nation. This is Ohio. How can that happen in Ohio?
Yeah, it's farmland, really.
Yeah, so we're going to have to figure out a way to reverse that and hope to put in place a campaign that we can make sure that doesn't happen again.
I mean, the nutrition is important, but just that touching base and making sure people are okay is really important as well.
Both of them.
And so it also makes sense that you were part of the White House Conference on Aging.
Yes.
So that only happens every so
5
often,
years.
right?
Yeah.
So tell us about that.
Well, they had one here in a mini conference in Cleveland, and it was a great experience. One of the things that unfortunately we're about 3 or 4 years past the time that we should have reauthorized the Older Americans Act. And the Older Americans Act, for the folks that don't know, was part of the Great Society programs of the Kennedy and Johnson administration. It at one time ranked up there with the Medicaid provisions and the Medicare provisions, also the Older Americans Act provisions. It's fallen on some hard times. We right now, the last thing I saw is that the senior population has increased 60% since 1980, and the funding of the Older Americans Act has gone down 34%.
Not good again.
Yeah, not good.
So we got to keep pushing.
So we're pushing.
You may benefit from one of the numerous programs provided by the Western Reserve Area Agency on Aging. How can you be sure? Give them a call and find out. The number's next. My thanks to Doug Beach for joining us today.
Learn more by calling the Western Reserve Area on Aging at 800-626-7277 or log on to www.psa10a.org. Next, a course on paying college costs.
Here at Metro Health, you know you matter when it matters most. Here, we are the city's best at preparing for the world's worst. Here, we are the only verified burn center in Ohio for adults and children. Here, you'll find exceptional clinicians with extraordinary hearts. So the work we do here at Metro Health makes an impact here, out here, and right here. Metro Health, we're here for you, for all of you.
Did you miss a phone number or website? Then here's your second chance, because we're going to list all of that information again. Then we'll be back to help you study for the test on saving for college. College costs keep increasing. So how can you keep up and help your child or grandchild afford a higher education? There are savings plans that can help you move to the head of the class, and here to teach them to us is my straight A law partner, Michael Solomon.
Hi, Lori.
So how much money are we really talking about here?
Well, the national average for a public university right now is almost $19,000 a year, and for private institutions, it's over $42,000 a year. So you might think, well, okay, you take that, multiply it by 4, and that's the number, but statistics show that it's longer to go through college than it used to be, and the average for a public university is over 6 years to complete a degree.
Wow.
Private universities are over 5 years. So you multiply that, you come up with a number, and it's a big number.
It's a real big number. Yeah. So do you think the degree is really worth all that dough?
Well, you know, again, it's when you see all that money going out, you might think it's a problem, but the U.S. Bureau of Census and the Bureau of Labor Statistics, they've analyzed all this, and they say the average over the worker's lifetime, they make $2.4 million if they go to college. And they make $1.5 million if they go just through high school.
$1 million bucks swing there, I guess.
So it makes it worth it still.
Does make it worth it. Yeah. So I guess we have to get savings. That's then. Right. So educate us on the best options.
Well, there are three basic options. The one, it's been around a long time, is the Coverdell Education Savings Account Fund. There's another one called the 529 plan. I think everyone's familiar with that. And then UTMA, the Uniform Transfer to Minors Act, a custodial account.
Okay, well, let's start with the Coverdell.
Okay, well, the Coverdell plan is a plan that you can put up to $2,000 away in this fund. And the money can be used for anything from kindergarten on up through college and after. And it grows income tax free. And they can, as long as they use it for those, tuition or books, computers, all that sort of stuff, educational supplies, that's valid. If they take it out and use it for something else, then they're going to pay income taxes on the earnings and a 10% penalty. But as long as they use it for that purpose, it works fine. And it's considered owned by the parent or the grandparent who sets it up, not the child. So you can change who the beneficiary is at any time.
Okay, what about a 529 plan?
Now, a 529 plan is the same sort of concept, except you can't use it, you can only use it for higher education. You can't use it for elementary school and that sort of stuff. So you can put in any amount you want, but if you put in more than $14,000, you may have to file a gift tax return. And again, it's considered the parent or the grandparent's asset. If you don't use it for the right purpose, you can pay income tax and penalties.
And a final quickly is the UTMA account.
Well, UTMA is a vanilla custodial account. You put money in there. If it grows, if it has earnings, it's taxed to the child. The first little over $1,000 is tax-free. Next 1,000 is paid at the child's rate. And anything above that is paid at the parent's tax rate. So, and then the money at age 21 basically becomes the child's to use, and it's also considered an asset when you fill out all those complicated forms to figure out how much money the government's going to give you in loans or that sort of thing.
Okay, lots of choices then.
Yes.
College costs can give you sticker shock. The best way to recover? Plan ahead by picking the savings plan that is right for you. We'll be right back.
Call Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.ssmplaw.com.
Thanks for joining us. On next week's show, what is AARP doing in Ohio? We'll find out about their programs and plans. Then, here comes the bride. We'll help everyone in the wedding party wear a beautiful smile. And stores are learning how to welcome those with Alzheimer's. Let's see what they do to make it easier to shop. But until then, please remember to make the most of your golden opportunities.
If you'd like to join our kitchen conversation, visit our website, www.goldenopportunities.tv. Like us on Facebook. Call us at 440-742-GO-TV or email us at kitchen@goldenopportunities.tv. We'd love to hear from you.
Golden Opportunities is paid for by Elder Productions.